El Rio Community Health Center is excited about a new designation they have received and how it impacts a portion of our community.
Carol Williams and Dr. Gabriela Ochoa are here to explain. Ladies, thanks so much for joining us today.
Thank you.
Thanks for having us.
So, Carol, let's start with you. Tell us about this designation, HEI, and what it means for El Rio and its patients.
Okay, so HEI is Health Equity Index, and it's really a distinction from the Human Rights Commission, which is an LGBTQ organization, and it's really saying that we're ready, able, and willing and wanting to provide care to the LGBTQ community. But we also have some standards, changing policies, procedures, things like that, in order to provide excellent medical care. But also it attacks, or our goal is to really decrease health disparities, and that's why it exists. It's really that there's a lot of people who don't get into care who are in the LGBTQ community, and so we're really wanting to get people into medical care sooner with primary care. And so it really, but it takes a lot of different things that we needed to do to get the designation. That required a lot of work on the part of staff and administration.
And so how is it that the center got involved with wanting to do this or start the process of being able to get this designation?
Okay. Well, it really started with a patient of ours that we've been seeing who is a transgender person, and really wanted us to improve our care. And we've always dealt with transgender people in our clinics, but we really wanted to improve what we were doing. So, when you come into a clinic, and large clinics like ours, it's really trying to make it friendly, making sure people are referred to appropriately. And she felt that we really needed to kind of improve some things, which we agreed. So we did some training. History, it was that we did some training. We had a focus group from the community and talked to them, got some feedback, but also, and what they thought was important for transgender care. And we started in that way, did a group where it was clinicians and other members of the team. Yeah. And so when we got together in those meetings, we really wanted to look at what kinds of services we could provide, but also where we needed to address things. So the HEI came out of that group in a way, and the COO at the time, which is Nancy Johnson, who is now the CEO, was very much a part of that process. So we really had a lot of support administratively to really bring this to fruition. And we had a consultant come in and really worked on a lot of policies, procedures, how to train staff, those kinds of things.
And we touched on at the beginning of the show that you guys are really at the forefront of all of this care. And Gabrielle, why do you think it takes so much training for staff to have a strong infrastructure? Why does it take so much training to help transgendered and other people?
I think some of it maybe people haven't been exposed to this population, and so so people may not know how to approach it, and it can be awkward. One thing I've learned is that this population often doesn't come get health care because of prior experiences, and it's been very scary to them. So so it's been, our trainings have included the lab techs, the x-ray, our front desk people, the nursing, all the providers, so that we can be exposed to this and then learn how to use proper language to make it safe for our patients to come once and then to be coming back to us to get their primary care, and then to also get their specific needs related to the transgender care in particular.
Do we know how big this population for transgender is here locally, community-wise?
We talk about that a lot. Yeah. So really throughout the nation, they haven't done a very good job, or they're trying to figure out ways to get numbers. So they are changing the system, with our EHRs. So right now we probably have around 80-some patients, 88 to 90 patients that are new, not brand new to us. Some of them have been there, but we really were probably more in the teens. So we've had an increase since we've been doing this, because we made connections with other people to make sure they knew that we were offering this. But it's really been hard to track. So now there is a requirement that has come through from the federal government that we are to use what we call sexual orientation and gender identity when people come in, so they can identify that. And then that way we can figure out, so we know kind of how many people, what are the needs, are we addressing those needs? and then in combination with other agencies.
Right, and again, you're hitting on other agencies. To have the complete picture, what are the different partnerships that you've formed with the different agencies?
So, so another issue is there's a lot of behavioral health issues with a lot of the population, but this population in particular. So Kodak is one agency that we've worked with, and they have particular group for transgender patients. And then the Southern Arizona Gender Alliance, SAGA, we've are partner with and keep in communication with.
And we have Southern Arizona AIDS Foundation. They have some groups for young people. And then there's other behavioral health systems, you know, certainly La Frontera, different ones that do probably serve those. Our main ones have been Kodak, the Living Out Loud program, and then SAGA, and that's been a very important one because that's the Southern Arizona Gender Alliance. It's been in the city for as long as I've been here, about 15 years, and they've done a really good job with doing groups and things like that, and so it's really for transgender people. And we were able to attend some meetings there. We also have 2 doctors, so we have a couple of doctors at Congress, and then 2 doctors, one is at El Pueblo and one doctor is at Northwest, that are for pediatricians dealing
youth
with
population. So
we're really got the continuum
Yeah.
of care from very young to, you know, into adulthood.
Well, I want to thank you guys for coming here. Like we were talking about, if people have had bad experiences in the past or they don't know where to turn, this is exactly why you're here, to kind of open it up to the community, let them know that there's a place that's available and ready to help them. So thank you, ladies, so much for getting the word out.
Okay, thank you for having us.
Oh, absolutely. For more information about El Rio Health Center, you can give them a call at 670-3909 or log on to elrio.org.